Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, I'm going to be covering anti-seizure, anti-epileptic drugs. If you haven't done so already, guys, please don't forget to like and subscribe to my channel, like this video, press that red notification button so you'll be notified every time a new video is released. Now, with my teachings, my lessons, that I do sporadically. Like, for example, right now I'm in Tampa for a soccer tournament, but I still wanted to deliver content to you. I have about an hour before my son's first game, so I'm making this video. The lessons I do, they're going to be sporadic. They're going to be whenever I have a moment. However, the questions that I practice with you, that I go over, that I teach you how to answer correctly and how to eliminate wrong answer choices, you will always get that every Sunday at 1 p.m. Eastern Standard Time. That does not change. Just, the times I do the lessons change. Don't forget, guys, I have audio lessons available for you on my website, www.nexusnursinginstitute.com. And guys can find me on TikTok, Instagram, and Facebook. Okay, now that I've given you all that information, let's get started. So, anti-seizure agents, these are medications that prevents seizures from happening. And basically, guys, seizure is just overfiring of those neurons in the CNS, okay? It's just, and I'll talk up to you guys about what can bring it on and what you can do to prevent it. But first, let's go over some key terms, very important terms for you guys to know. The first one I have here is that absent seizure, something that's important for you guys to know about the absent seizures. We see this often in peds. So if you're taking peds right now, or you're taking neuro, you do need to know that absent seizures, we often see that in pediatric patients, and it's often mistaken for them daydreaming. And here's why. Take a look. It says it's a type of generalized seizure that's characterized by sudden, temporary loss of consciousness. You see the patient staring or blinking for 3 to 5 seconds. So very often, patients having a seizure, but the teacher thinks, or the parent thinks, that they're just daydreaming, okay? This was formerly known as petit mal seizure. Another one you guys need to know is status epilepticus, and I talked to you guys about this already. Whenever you see that word status, you know that means medical emergency. Status epilepticus is a state in which seizures rapidly occur. Most severe form of generalized seizure. This is an emergency. The lighting's bad in here, guys, but I'm doing the best I can. Tonic-clonic seizure. This is a generalized seizure that's characterized by serious involuntary muscle contractions. All right, as students, if I were you, I would know these drugs that I put stars next to. I would make drug cards. And for example, drugs for treating generalized seizures, I'd have that on one side of the drug card with the hydrantoins. And then on the other, on that same side of the drug card, I would have these 3 meds. And on the other side of the drug card, I'd go ahead and make sure I knew, the intervention, the therapeutic actions, the adverse effects, and of course, the nursing interventions for that class. I would make drug cards for them. And I put a star next to the drugs that you're most likely to see on NCLEX, okay? So make sure you take a look at this list. Let's see if I can zoom in for you. The lighting's really bad. Don't say I didn't warn you. All right. Okay, so let's get started. Epilepsy, is not a single disease, but a collection of different syndromes. Whenever you see that word syndrome, guys, that means cluster of signs and symptoms that lead or point to a disease or disorder, okay? Different syndromes characterized by the same feature. What's that feature? Look at this, guys. Sudden discharge of excessive, as in too much, electrical energy from nerve cells located within the brain. This leads to a seizure. The drugs that are used to manage epilepsy are called antiepileptics or anti-seizure agents. They're sometimes referred to anticonvulsants. Whichever word you see, guys, it's meaning the same thing, okay? The drug of choice for any given situation depends on the type of epilepsy. patient box, and we'll see that in a second, specific patient characteristics such as cultural variations and patient tolerance for associated adverse effects. So let's talk about the classification of seizures. Accurate diagnosis of seizure types important for determining correct medication to prevent future seizures while causing the fewest problems and adverse effects. And over here, I wrote you, the RN. What you, the RN, or you, the LPN, tell the RN, that information is what's going to be used to formulate that patient's diagnosis, the type of seizure disorder that they have, the medication treatment that patient's going to be on, their whole plan of care, guys, medically speaking, and from the nurse's point of view. So, excuse me, you have to be very alert to this, to the patient that has seizures. Let's look at this box 23.2. By the way, I've gotten some questions about what book I'm using. I use several books when I'm teaching, but out of this one, I'll show you. This is what it looks like. Okay, so this is the book I'm teaching out for this video. Anyway. So this box says drug therapy across the lifespan. It goes over children. I want to touch on the adults for now. Look at what it says. It says for adults, they should be encouraged to carry medic alert bracelet or identification to alert emergency personnel that epileptic drugs are being taken. That is on NCLEX. I don't know why I don't have that highlighted. Hold on, guys. You absolutely need to know this. Okay. What else does it say? Women of childbearing age should be encouraged to use contraceptives while taking these drugs. Why? Because you shouldn't be taking these drugs if you're pregnant. And if you are pregnant, you're taking it, as a nurse, you have to absolutely make sure you tell the patient those risks. If a pregnancy does occur, or if a woman's taking one of these drugs, desires to become pregnant, the importance of the drug to the mother should be weighed against the potential risk to the fetus. Mom has to be informed as makes that decision. Does she want to risk, you know, what it can do to the fetus versus what can happen to her? Look at this. Stopping an antiepileptic can precipitate seizures that could cause anoxia and its related problems for the mother and the baby. Absolutely. When a patient's been taking anti-seizure medications and they stop, them stopping that anti-seizure medication is enough to bring on seizures. And if that patient has a seizure for long enough, guess what's not getting to the brain? Oxygen. Okay, so it absolutely will and can affect their brain. Women who are nursing should be encouraged to find another way of feeding the baby. Why? Because this medication does cross over to breast milk. Okay. Older adults, older patients may be more susceptible to the adverse effects of these drugs. Why? Because the older that you become, your kidneys don't work the way they used to, which means they're not filtering out this medication, which means the medication is staying in your body longer. And your liver is not working the way it used to, which means you're not metabolizing these drugs as fast as you used to, which means that the medication stays in your body longer. So old, and here's a third reason. Remember, the geriatric patients, they lose their sense of thirst. So they tend to be dehydrated. So think about it. Dehydration, along with kidney function and liver function not running the way it used to, patients at high risk for what? Drug toxicity. So elderly patients who, you know, do have seizures or has epilepsy, they will need a lower dose than your normal, younger, healthy adult just because of those three reasons that I just told you. Dosages of all of these drugs may need to be reduced, and I just explained to you why. Patients with renal or hepatic impairment should be monitored. Serum levels of the drug should be monitored, and you have to encourage a patient to wear medic alert identification. Wow, it's been 2 pages, and twice they've told us the patient needs to wear medic alert bracelet. What did I tell you guys when the author or the book writer keeps repeating the same information? That means it's important to know. That means you're most likely going to see that on an exam somewhere. Right? All right. Next. And yes, I'm sipping on my coffee. If you have a problem with that, guess what? I'm giving you this teaching for free. So suck it up or go to another channel. I don't know what to tell you, but I need to drink my coffee for my head to be on straight this morning. All right. Generalized seizures are further classified into the following types, and they have all these different types, but I'm just going to go over the ones that tend to show up on NCLEX the most. You guys can read about the others on your own, okay? Number one, tonic-clonic seizures. And over here, I wrote no different seizures. If you're in med-surg, you will be questioned on the different type of seizures, so make sure you know them. So tonic-clonic, this involves dramatic tonic-clonic muscle contractions. These are very strong muscle contractions. They're not just, you know, like this. They're like this, very strong muscle contractions, okay? Aggressive spasms. Patient loses consciousness. Let me tell you something. If a patient tells you that they had a tonic-clonic seizure and they tell you, while I had the seizure, the nurse said this and the doctor said this and my mom did this and my girlfriend was screaming, blah, blah, blah. Guess what? It most likely was not a tonic-clonic seizure because they lose consciousness. They don't know what's happening during the seizure. Matter of fact, after the seizure, they're very confused, they're very disoriented. And one of your nursing interventions is to reorient them, okay? 2, absent seizures. This involves abrupt, very fast, 3 to 5 seconds, abrupt period loss of consciousness. We often see this in who? Children, okay? It disappears by puberty, and it does not usually involve muscle contractions. And that's why this type of seizure is usually mistaken for, oh, you know, they're just, what's that word when somebody doesn't pay attention? Distracted easily, or they're daydreaming. And meanwhile, they were having absent seizures, okay? And the last one, and I put a little thing next to here that says NCLEX, because this is what shows up the most, status epilepticus, potentially the most dangerous of seizure conditions. It's the state in which seizures rapidly recur again and again. Look at this, guys, with no recovery between seizures. What does that tell us when there's no recovery between seizures? That tells us that patient's not getting oxygen to the brain because the seizures are going back to back to back to back. There's not enough time for oxygen to get to the brain. Status epilepticus is an emergency and you better call 911. Drugs for treating generalized seizures. Okay, because, drugs typically used to treat generalized seizures, they stabilize the nerve membranes. Because they work generally on the CNS, look at this, sedation and other CNS effects often result. And that makes sense because remember, seizures is just over stimulation of that CNS. So it makes sense if the patient's taking anti-seizure, anti-epileptic drugs, it's going to do the opposite, depress that CNS. So we're going to see a lot of our adverse effects and the nursing interventions we're going to be doing for the patients that's taking this type of meds are going to be geared towards that depression of the CNS that the patient's going to be experiencing. Various drugs are used to treat generalized seizures, including, these are the drug classes you guys need to know: your hydantoins, your barbiturate-like drugs, your benzodiazepines, and your succinamides. Now, if you already watched the last video I did on, the benzos and the benzo-like and the barbiturates, you can skip this part and just do the other two. If not, guys, make sure you watch my other video that I did on those medications. Absent seizures, which is another type of generalized seizure, may require drugs that are different than those used to treat or prevent other types of generalized seizures. The succinamides and drugs that modulate the inhibitory, these are your GABAs, guys, are most frequently used. So we're going to start with the hydantoins. Remember, I told you to make a drug card. The most important drug you need to know in the drug class of the hydantoins are this: phenytoin, that's your Dilantin. And it's easy to remember because they both end in TOIN. You see TOIN, TOIN. Your Dilantin, that is the most important drug in this family, okay? Because hydrantoins are generally less sedating than many of the other antiepileptics, they may be the drugs of choice for patients who are not willing to tolerate the sedation and drowsiness. Because remember, these anti-seizure drugs depress the CNS. You see lots of sedation and drowsiness. So those patients that are just not willing to deal with that, this is a great drug class. And this is why I told you this is the most important one to see in this category, because we'll see this often when it comes to NCLEX, okay? Well, before I jump to pharmacokinetics, let's talk about the therapeutic indications and actions. They reduce the tonic, clonic, muscular, and emotional responses to stimulation. Because remember, what's happening is overstimulation, and what it does, it reduces the reaction to it, right? Pharmacokinetics. You need to know this. I promise you need to know this. I don't know why I didn't put an NCLEX next to it, because it sure is on NCLEX. Or shows up on an NCLEX, I should say. All right, therapeutic dilantin level range, 10 to 20. Professor D, do I need to know this? Yes, you do. All right, so when it comes to the hydrantins, dilantin, contraindications and cautions, obviously any allergy, pregnancy or lactation, again, you have to teach the woman to use contraceptives so she does not get pregnant on this drug. If she wants to get pregnant, you are going to have to explain to her the risks, okay? Discontinue the drug could result in status epilepticus, excuse me, which is a neurological emergency. It has a high risk of hypoxia for the mother and the fetus. Again, teach her to use barrier contraceptive. When the book says barrier contraceptive, what are they talking about? Condoms. That's what they're talking about. Teach her to use a condom. If pregnancy does occur, the woman should receive educational materials and counseling, not just verbal education. Give her pamphlets for her to look through too as well. Maybe even play a video for her. Again, caution should be used in the elderly or debilitated. I already explained to you why. Impaired renal liver dysfunction, hepatic dysfunction. Caution should be used when giving I can't pronounce, guys. Ethatoine to diabetic patients and patients with severe cardiovascular problems, and other contraindications, guys. Coma, which it makes sense if this drug decreases the CNS. Why would we give it to somebody who's in a coma where their CNS is decreased to the max? Does that make any sense? Depression or psychosis, where psychosis is when the person is out of touch with reality. So these conditions, you are not going to give this type of drug to that type of patient, okay? Let's take a look at this table. Some things I want to go over with you very quickly. Again, phenytoin dilantin is for treatment of tonic-clonic seizures, prevention of status epilepticus, ethosuximide, Zerantin, that's a drug of choice for absence seizures, the ones we tend to see in children. And valproic acid, this is your Depakote. This is another drug you absolutely have to make sure you make a drug card for it. This is a drug of choice for myoclonic seizures. It's the second choice drug treatment in absence seizures. Whenever you guys are studying and you see drug of choice, pay attention. That means that is a #1 go-to drug that we would give for this type of situation. That's important for you to know. All right, let's talk about the adverse effects of the drugs that fall under the phenytoin class, okay? Look at what I wrote here. Everything is decreased. It depresses. The most common adverse effect related to CNS depression and its effects on the body function. Look, depression, confusion, drowsiness, lethargy, fatigue, constipation, dry mouth, anorexia, cardiac arrhythmias. You see that list. Decreased blood pressure, loss of libido, okay? Specifically, the hydrantoins may cause severe liver toxicity. So that lets me know before the patient gets on this, and I know that it could cause severe liver toxicity, I would need to look at what? Those liver enzymes, that liver panel, right? I want to look at that AST, that ALT. I want to see what that liver is looking like, because if the liver's in trouble, do I want to give this medication to the patient just because the doctor ordered it? Absolutely not. You guys see the climate, you see what's happening here. Okay? Don't do it. You are going to withhold that medication and call the physician. Bone marrow suppression. What does that tell me? This medication can cause bone marrow suppression. Before I look at it, before I give that medication, I'm going to be looking at those CBCs, right? Because remember, the bone marrow is what makes your platelets. It makes your white blood cells. It makes your red blood cells, right? So if those bone marrows are in trouble, if the bone marrow is in trouble, I'm not going to give this med. I'm going to be looking at the WBC, the platelet, the RBC to see what's going on. It can cause gingival hyperplasia, and I put an NCLEX next to that because that's the example they ask about the most that shows up on NCLEX. That's very important. You teach that patient that if you notice you start having painful gums or swelling gums, let us know immediately. Stevens-Johnson syndrome, which is a lethal skin condition, okay? So you better be assessing that patient's skin. And frank malignant lymphoma, all of which are directly related to cellular toxicity. Let's look at this tiny box and what does it say here? Patients being treated for epilepsy should be advised not to use herb evening primrose. I don't know how you pronounce it, guys. Do you say primrose or primrose? Maybe it's primrose, but you see it, all right? Patients being treated with barbiturates or Phentoin, that's Dilantin, should be advised not to use ginkgo or ginkgo. Anyway, let me tell you something. Just make it a rule of thumb. No herbs. How about that? Tell your patient to stay away from herbs and over-the-counter drugs. Do not take them without discussing them with the physician first. You're going to teach that to the patient. It's very important. All right, when it comes to Dilantin, again, guys, they're going to be, it's very important when it comes to Dilantin that you're going to be assessing that patient. Like I said, you're going to be looking at the WBCs. You're going to be looking at the patient's liver function. You're going to teach them about the gums. You're going to make sure that you're assessing their skin very, very closely because you don't want them to develop Stevens-Johnson syndrome. Guys, I promise there's going to be a part 2. I'm teaching here, but I'm in the business office and it's shared with anybody that walks in and I don't want to be a disturbance. So I promise there's a part 2 coming. Part 2, guys, I'm going to be covering barbiturates and barbiturate-like drugs. Please sound off in the comments. Let me know what you thought about this video. If there's anything that you'd like me to cover that I haven't covered already, or if there's something you want me to cover more extensively, let me know. Let me know if you want me to cover questions or do a lesson for it. Guys, thank you so much for watching this video and you'll see me on the next video.